Hello friends, today we are going to discuss an important aspect of obesity and reproduction. We are basing our discussion on an article which was done by Dr. David in the University of California in the Department of Reproductive Medicine. Obesity is more common in women than in men. It has effects, that is, there could be an increased chance of having a delay in pregnancy. There could be problems in pregnancy in form of miscarriage. There could be premature labor. There could be stillbirth. They could have comorbidities like diabetes and hypertension. There could be a greater need for operative delivery. And even after the delivery has happened, the patients are at a higher risk of wound infection and thromboembolism. Now, obesity increases the healthcare cost. That is, 30% of the women are obese. That increases the healthcare costs. So, why obesity is more common in women? First thing is that their food intake is more than requirement of the body. Women gain more weight because of pregnancy also. And if there is operative delivery, women cannot shed that extra weight which they could otherwise do by breastfeeding. Now, the consequences of obesity in females are that because obesity causes chronic inflammation, oxidative stress, insulin resistance, and higher chance of developing PCOS in males, it causes epigenetic changes in the DNA, and as a result, it indirectly affects the offspring also. Now, why obesity should not be considered as a contraindication for IVF? So, in most of the guidelines, if the patient had a BMI beyond a certain limit, they would refuse IVF and then tell the patient to do aggressive weight loss. And if the patient undergoes aggressive weight loss, it is still not good for the patient and the baby, because if the patient has undergone massive weight loss, it will cause small for gestational age babies. That is, it would cause small babies, or it could cause problems which would pass on to the next generations also. And sometimes when the patients are told, sent home, and they are told that please go and lose weight and then come back, most of the times they fail. They do not undergo that much of weight loss as is expected. However, if a fertility consultant keeps the patient under their observation, keeps on motivating the patient, they could have a better chance. They should be motivated to get a single embryo transfer. That's the most important thing one can do. And in the pre-IVF, during the IVF, and after the IVF, the patient can be kept under a motivation. That is, the patient should be kept under lifestyle, diet, exercise. These kind of things can be continuously told to the patient, and they will have a slow weight loss, but it will be more consistent and progressive. So, lifestyle modification in the supervision of the doctor before the treatment has started really helps the patient. So, instead of telling the patient to crash diet, the weight loss should ideally be consistent, slow, and progressive. That is good for their health also. So, undergoing fertility treatment is an opportunity for the patients to be under the supervision of a fertility specialist during and after the IVF treatment, and the patient can have a best chance for weight loss. Thank you.